Welcome to today's Explainer. We're going to tackle a medical topic today that honestly sounds incredibly intimidating when you first hear the name, but I promise you, by the end of this, you're going to have a crystal clear understanding of exactly how it all works. We're diving into Wernicke-Korsakoff Syndrome. Now, you know the human brain is an absolute marvel. It's the most complex structure in the known universe. But despite all that amazing complexity, it is deeply, deeply sensitive to its fuel supply. And that right there brings us to the core of what we're looking at today. So think about this. What actually happens to the brain when it is starved of just one essential vitamin? We so often think of neurological conditions as being caused by genetics or physical trauma or, these really complex progressive diseases. But today, we're going to see exactly what happens when the brain is simply deprived of a single crucial nutrient. It's a fascinating, sobering, and honestly, ultimately empowering look at how biological starvation directly affects our cognitive world. To get there, here's our roadmap for today. First, we'll hit Section 1, the vitamin B1 connection. Then, Section 2, Encephalopathy warning signs. Next is Section 3, Korsakoff Syndrome and memory. And finally, Section 4, the golden treatment rule. All right, let's jump right in. Section 1, the vitamin B1 connection, uncovering the root cause. So at its core, Wernicke-Korsakoff syndrome occurs mainly because of a severe deficiency in thiamine. You probably know thiamine better as vitamin B1. Think of thiamine as a fundamental building block for the brain's energy factories. Without it, well, the brain essentially starves. Now, it's important to note this deficiency is commonly associated with chronic alcohol use. We look at this fact completely without judgment. It's simply a medical reality. Chronic alcohol use severely disrupts the body's ability to absorb and actually use the thiamine from our diet. Over time, this leads to a really profound deficit, basically setting the stage for the syndrome to take hold. That brings us to Section 2, Wernicke Encephalopathy warning signs, the physical phase. When the brain is starved of vitamin B1, it literally starts to misfire physically. This is the brain sounding the alarm. Patients experience profound confusion. They develop an unsteady gait, which in medical terms is called ataxia. That's essentially a loss of physical coordination that just makes walking super difficult. You'll also see tremors, noticeable muscle weakness, and sudden vision changes. The body is effectively losing its neurological tether here. It is a very acute, highly physical state of emergency. Now, one specific vital vision change you might encounter is something called nystagmus. This simply means abnormal, often completely involuntary eye movements. The eyes might dart rapidly from side to side or maybe up and down. I really want you to know this term because it is a classic, easily observable clinical sign. The brain structures that control our eye muscles are highly sensitive to thiamine depletion, so nystagmus becomes one of the absolute most visible red flags of Wernicke encephalopathy. And this comparison right here brilliantly illustrates the overall progression of the condition. We essentially have two halves to this syndrome. Wernicke encephalopathy represents the acute physical symptoms. It's an immediate crisis. Korsakoff syndrome, on the other hand, is the chronic cognitive effect. Think of it this way. If the acute Wernicke phase is a fire burning in a house, Korsakoff syndrome is the permanent structural damage left behind if that fire isn't put out in time. Which leads us to Section 3, Korsakoff syndrome and memory, the cognitive phase. When a thiamine deficiency goes untreated, the damage settles deep, deep within the brain's memory centers. It's a really tragic shift. Patients suffer from severe memory loss and a profound difficulty learning any new information whatsoever. To anyone on the outside looking in, these look very much like dementia-like symptoms. And alongside these severe cognitive deficits, patients also often develop peripheral neuropathy. That's nerve damage out in the extremities, causing pain or numbness. But honestly, it's the memory loss that is perhaps the most devastating part of this phase. And this memory loss leads to a deeply, deeply misunderstood symptom: confabulation. This basically means the person fills in their memory gaps with invented information. Now, the absolutely crucial thing to understand here is that the patient is not lying. They aren't trying to deceive you. Their brain is just severely damaged, and in a desperate attempt to make sense of a really fragmented reality, it subconsciously stitches together a story to fill the void. It's literally the coping mechanism of a wounded brain. Understanding that fundamentally changes how we care for and interact with these individuals. But there is definitely hope and a very strict medical protocol to follow. Let's look at Section 4, the golden treatment rule, intervention and care. Okay, if you only take away one single thing from this entire explainer, let it be this: give thiamine before glucose, always. This is the absolute golden rule of treatment, and here is exactly why. Think of a patient's brain like a car engine, right? Glucose, or sugar, is the fuel. Thiamine is the spark plug. Now, if a patient comes into the ER confused and stumbling, the immediate instinct might be to give them a glucose strip for energy. But if you pump fuel into an engine that has absolutely no spark plugs, what happens? You flood the engine. Giving a thiamine-deficient patient glucose before giving them thiamine forces the brain to try and metabolize that sugar without the necessary tools. This can actually worsen the neurological damage and permanently cement the condition. So thiamine absolutely must come first, no exceptions. So what does that proper intervention actually look like? Well, it's a highly structured, logical process. Step 1, immediate thiamine replacement. This is really commonly ordered as 100 milligrams, just to jumpstart the whole system. Step 2, because severe thiamine deficiency rarely happens all on its own, medical professionals will bring in folic acid and other multivitamins. And step 3, providing overall nutrition and hydration to stabilize the body. It is a full-on, comprehensive rescue of a starving system.
And of course, treatment doesn't just end with that first dose. Care teams have to continuously monitor both the patient's neurological status and their blood glucose levels. Recovering from that acute Wernicke phase requires really vigilant observation. You have to ensure the brain is actually utilizing the nutrients properly and, most importantly, prevent any slide into that chronic Korsakoff phase we talked about earlier. Which brings us to our final thought for the day. How can understanding the critical role of a single vitamin change the entire way we approach neurological health and intervention? Wernicke-Korsakoff syndrome shows us just how fragile, yet how mechanically logical our brains truly are. By understanding the profound power of vitamin B1, we don't just learn about a medical syndrome, right? We learn the immense value of proper nutrition, the power of targeted medical knowledge, and the absolute necessity of empathy for those suffering from cognitive damage. Thank you guys so much for exploring this fascinating topic with me today. Keep asking questions, keep learning, and I'll catch you in the next explainer.